The SHA Ghost Hospitals scandal could be bigger than initially thought, and it seems the Nyandiwa Medical Center issue was just the tip of the iceberg. Now, Kenyans have done some digging, in SHA's records and in the MOH, that's the Ministry of Health records, and the data zenye zimekuwa retrieved are quite startling. Let me just give you a rundown of some medical facilities. Zingine ni non-existent, zingine ni room moja, na Kenyans wamechambua wakapata kwamba these medical facilities zina receive millions. Now there's Hanano Medical Center, which is non-existent, received 4 million shillings from SHA in June. Ayale Medical Center, which is in Mandera, received 8 million shillings from SHA. Now what's interesting, ni Mandera kuna wizi inaendelea sana, because most of these medical facilities zimekuwa registered in Mandera. Kuna Duale'S Medical and Diagnostic Center, 3.6 million. And inaweza kuwa ziko Mandera because now kama hosiko Mandera wewe utaenda kutrace aje. Lazano Healthcare in Mandera again received 6 million shillings. Duale'S Medical and Diagnostic Center, 3.6 million shillings. What's important to note about Duale'S ni kuna 3 institution medical facilities zenye zimekuwa registered kwa the Ministry of Health records with the Duale'S name. Kuna medical center, kuna dispensary which is public, but the private medical center receives more money than the dispensary, and it's a tactic in the Kenya Somegundo inatumika kuiba pesa from SHA. Register a facility under 3 different names or 2 different names, one as a public entity, other one as a private entity, and then of course the private entity gets more money than the public entity. Now Trenya Hospital in Kisii, non-existent, 4.3 million shillings in June. Zamzang Nursing Home in Ramu, mnakumbuka tutoke Modogashe twende Ramu, 8 million shillings in 3 months. Belgoron Medicare, 2.8 million shillings, na hiyo ilianza kureceive pesa in April. And if you dig through, SHA's records, unapata this scandal, this heist ilianza all the way from April to August. So watu wamekuwa kikula vizuri. Kadasamu Medical Center received 2.8 million shillings in June, but it's non-existent. And of course the CS for Health Aden Duale'S may suspend hospitals, around 40 hospitals, akisema they are questionable, but unasema those could have just been for optics, kwa sababu the owners have not been sued, and they have not been held legally accountable for those misdeeds. So anasema mazejo, kuna shida MOH, kuna shida SHA, watu waache optics and let the actual purge begin.
Bro, have you heard of the SHA story? Hii maneno ya SHA. Have you seen where these payments are going? They are going to, most of them, close to non-existent institutions. Non-existent health institution. And you remember, there was some months ago, Okio Mtata said, unakumbuka, hiyo video nilifanya hapa. And people were like, no, he's now wanting to be the president, so he must portray himself as an opposition. Alisema, SHA is a big scandal in waiting. Why? It is just a way of siphoning money from the public to enrich few individuals. Now, a section of Kenyans are calling for the occupation of the SHA offices because Kenyans need an explanation.
Machaji na manyonyo, sasa kuna kitu inanibamba kama hii scandal ya SHA. Wacha watu wakule hiyo do. Ati yo Duale ataingia hapo hivyo atasafisha rada. Umecheki North Eastern. Ati kuna hospitali imepigwa mita 6, ukienda kuangalia ni kimawe mtu wangu jo. Ingine tu ni kiwanja, hata kuna kitu. Tuko tunaongea historia ya SHA, wase wanatutusi kwa hii comment section, tuko tunashambuliwa du hivi. Wacha sasa hiyo do ikulwe sasa. Unacheki? Juu kama hivyo ndio watu hutaka. Juu sasa sasa wewe ni mtu tutam, kitu mbaya bado tunaisupport. Hata kama ni mimi nipate na hiyo SHA saa hizi. Nayo. Nimecheki hospitali fulani kwa hivyo ni Nyanza. Buda ni mabushi inapigwa sijui mita 4. Unaona? Na bado ngoja hii ngori ya nini hii housing, affordable housing, kuna hiyo ngori inakuja, mtashtuka jo. Watu waliletu kusema tu tam sawa. Sasa hizo acha ni kwa mmoja. Sasa hizi hakuna kupinga mtu. Mtu akisema ni hivi ni hivyo. Sisi wengine tukaa tu na kuangalia kwa umba. Ustake jua.
When you see the president and his friends saying that SHA is working, they mean that it's working for them. ndo zao zinaingia. Lakini for the people of Kenya, it's a different story. So SHA has been discovered to have been paying like fraudulent claims that aren't there. They just pay. And they've been paying these fraudulent claims to hospitals that don't exist, hospitals under construction, clinics that aren't there, and most prominently, a hospital owned by the guy who runs SHA. In the meantime, there's been the persistent problem of people going to get treated in hospital and SHA not paying for them. They wanted to register though. More registrations, more money for them. In fact, when the president talks about SHA, he brags about how many people have registered. He doesn't talk about other things. There are no metrics he finds more useful than how many people are bringing in the money. This scandal is really, really bad because one of the main agendas in the manifesto of the current regime was universal healthcare. This is something they set out to do from the beginning, but the way they've done it, it is a big, big, big mess of corruption and one that is leaving Kenyans without proper healthcare.
Salam guys, the owner of Ladnan Hospital where Grace was arrested is the chairperson of SHA, appointed for the next 3 years by yours truly, Kasongo. Now, this is where it gets interesting. So SHA works in selective places, and if you ask me, I believe the selective places where it works, there are people who are benefiting directly from the proceeds of SHA. So it is working at Ladnan Hospital because he is also the chairperson of SHA. So yeye anajipelekea nini? Anajipelekea biashara, then directly he's reaping from SHA. That's why people are saying SHA is working selectively, selective few places. Now, I wanted to show you something. Please watch the next video, tafadhali.
Yo ni aje wa Kenya. Hapa tunataka ni kuonyeshe venye tumecapture wizi ambao unaendelea kwa SHA, Social Health Authority. Now, these are for the paid facilities August 2025, okay? Now, this August, na ukumbuke mapolisi wajalipwa. Either way, ukiangalia hapa nataka upay attention sana. Kuna hiyo hospitali ama dispensary inaitwa Nyandiwa Dispensary ambayo imekuwa allocated, sijui kama mnaweza ona, imekuwa allocated 19,998,720 shillings. What is the name of that hospital? Ukikama hapa close, Nyandiwa Dispensary. Now, ilikuwa inaklaimiwa kwamba haijakuwa allocated money mpaka response to Nyandiwa Level 4 Hospital Fund claims. There have been claims on social media that Nyandiwa Level 4 Hospital has not received any funds. There are also claims that the Nyandiwa Dispensary, which is currently closed, received 10,008 shillings. In response, Mwangangi clarified that Nyandiwa Level 4 Hospital received 19 million. She explained that the funds are allocated for long patient stays and maternity services from January to June 2025. Mwangangi added that facility has since confirmed receipt of the funds. The Level 4 Hospital has confirmed receipt of the funds. SHA remains committed to timely payments, accountability, and transparency. Guess the hospital they are talking about. This is the hospital, guys. This is an unfunctional hospital. It's not functional. This is Nyandiwa Health Center, West Kamakag Ward. So, where does that money work? Where is that Nyandiwa? Which one is that? Because this one is non-functional. It's not functioning. Okay? It's closed. So, wewe bwana wacheni kuchezea president. Yani mnapatiwa pesa lakini nyinyi mnatupa kwa mfuko mkishama hospitali inafanya kazi. Aye, which This is the hospital. Nyandiwa Health Center, West Kamakag. A whole 19 million. A whole 19 million Kenyans. Where is it going? Who has taken this 19 million? Which hospital? Who are these? Jesus Christ. This is so sad, yeah? That is the state of the so-called hospital. That is how it looks like.
Nyandiwa Health Center. Hii hata hakuna mtu anaingianga hapo. Hata umbu waziishi hapo. Either way, subscribe, follow me. Thank you. I appreciate.